Good morning. Good morning. Welcome to Central Health Talks on KAZI-FM 88.7. I'm Ted Burton with Central Health, and I'll be your host for the next hour. Today, we're talking about COVID, just like everybody in our community is talking about COVID. But we're talking about why and how COVID affects certain segments of our community more than others, and what we can do together to address this inequity. We have two distinguished guests this morning that I'm excited to introduce. Dr. Nicholas Yagoda. He is the Chief Medical Officer for Central Health Affiliated Community Care. Dr. Yagoda, thanks for being with us this morning. And I think you're muted, but we'll get that taken care of. And Dr. Charles Moody, he is an author and director of Leadership Strategist Consultant Company and an organization called Community Coalition for Health. They've been a trusted partner of Central Health as we try to reach communities and populations that just don't have appropriate and adequate access to information about COVID-19. Dr. Moody, thank you for joining us this morning.
Thank you, Ted. Glad to be here.
The phone lines will be open throughout the show as they always are, and we encourage you to join our conversation. If you have questions or comments, you can call 512-836-2887. That number is 512-836-2887. But let me set the stage. There have been more than 70,000 cases of COVID-19 in Travis County as of this morning. And right now, as we sit here having this conversation, 504 people are hospitalized. So far, in Travis County alone, there have been 672 COVID-19 related deaths. And these numbers are changing constantly. We just heard in the news break from the Associated Press, there have been now 447,000 deaths across the country from COVID-19. In Texas, we've had more than 36,000 fatalities and 2 million confirmed cases. These are a lot of numbers to talk about, but really it's the people behind the numbers that we've got to focus on. Today, we want to talk about long-standing systemic health and social inequities that have put many people from the African American community and the Latino community at increased risk of getting sick and dying from COVID-19. In addition, I'm sure you've had conversations with families and friends and church members talking about the fact that in the first weeks of the vaccine rollout, statistics show that Black Americans and Latino Americans are receiving COVID vaccines at dramatically lower rates than white Americans. This is something that must be talked about and must be addressed. And we're going to have that conversation here today. We'll talk about vaccine distribution, but also almost important is vaccine safety. We want to talk about some of the skepticism and fear about the vaccine that is warranted and justified and appropriate. But we do believe that we can address some of those fears with facts. I want to start with Dr. Yagoda. As I mentioned, he is the Associate Chief Medical Officer at Central Health Affiliated Community Care Health Centers. Dr. Yagoda, thanks again for joining us. I know you've been working night and day for the past, we're going on a year now, but could you talk about specifically what community care, well, actually talk about what community care is. Not everybody listening is going to know what community care is and what you do, but then your role, your historic role in Travis County of addressing healthcare disparities for people with low income, communities of color, some might say vulnerable populations.
Yeah, so thank you, Ted, for the introduction and for welcoming me to this conversation. Community care is what we call a federally qualified health center. It means we are a community-driven healthcare provider that serves principally low income and medically vulnerable individuals and underserved communities in general. We provide high quality, affordable primary care and preventive care, specialty and dental care, as well as services for mental health, substance use disorders, pharmacy services as well. So it's quite an array, largely due to really important collaborations with community members, including our central health partners. But we've really developed a fairly robust safety net for those individuals who are not otherwise covered by insurance entities through employers or state or federal funding. Almost all of our patients are low income, and the majority do come from racial or ethnic minority groups. So really at the core, we are oriented towards advocating for health equity in general within this community.
I would like to add that many of Community Care's patients are also medical access or program or MAP members. Central Health's MAP program is a health coverage program for people with low income, and we provide health coverage for people that are up 200% at the federal poverty level or below. So Dr. Yagoda, based on who you care for, your patient population, can you talk about how COVID-19 has affected your patient population and really exacerbated health disparities for African Americans and Latinos?
So I think it is not a coincidence that the rise in awareness of issues of equity and social justice have arisen in tandem with the COVID pandemic over the last year, both on the national stage, or frankly, global stage, as well as regionally. Again, because so much of our work is oriented around viewing healthcare as a right, not a privilege. Out of the gate, we recognized that this pandemic was going to put extraordinary pressure on vulnerable communities because it required shifts in public behavior, but also disproportionately affected communities that don't have the luxury to socially distance. I'm talking mostly about essential workers who don't have the ability to telecommute, who live in multi-generational homes, who don't necessarily have the means to afford childcare or healthcare itself. So with this in mind, we really stood up very quickly the necessary support so we could have visibility into to what extent this pandemic was hitting vulnerable communities. We stood up the region's first free public testing sites, putting most of them in eastern Travis County to make sure that communities generally with more limited access to healthcare services would be targeted by our efforts. We also set up our the very first contact tracing unit within our community health center in collaboration with local community organizations. We were distributing PPE to high-risk communities. And to your point that you made before, we've really oriented all of our vaccine programming around our own patients who overrepresent those most vulnerable to coronavirus infections and complications of COVID-19 itself. We've recognized that we've had to shift a lot of our work in response to this pandemic, but in particular, the collaboration with community partners has come to the fore. And I think one thing that I hope we can celebrate and continue to sustain over the coming years is how effective these collaborations between partners all oriented around the same mission of health equity are, and how much power that collective can really bring to this very challenging issue.
That's a perfect opportunity to introduce our next guest and have Dr. Charles Moody join our conversation. Dr. Moody is a pastor and author and a community organizer, and his organization, Community Coalition for Health, has been working with Central Health and Community Care to reach some parts of our community, people who just don't have the same access, don't have the access that they should have. And Dr. Moody, thank you for joining the conversation. I wanted to ask you about Dr. Yagoda. You mentioned the importance of these community collaborations, and getting information out there. I know, Dr. Moody, you're aware that sometimes the information that is put out by the government or other organizations doesn't even speak the same language or address people from where they are. You know, there are a lot of assumptions made, and the materials aren't culturally appropriate. I wonder if you could talk about that.
Sure, thanks, Ted. One of the things that we have to understand is when you look at the community and we look at the term community, you know, that we have to talk about how there's a wide variety of language, of places. I like to call them watering holes where people gather. I like, and so one of the things that's happened and that happens over time is that even when you have entities such as community care or central health who may have the services and the ability and even the desire or drive to meet the needs of the community, they don't really know how to get to the community. And then when they get to the community, you know, there's a language barrier. We say things different. There's a different meaning behind things that we infer. And also there's a history. So the cultural barriers deal with language. They deal with a placement of message. They deal with even the idea of some of the imagery and the wording that's utilized. They convey certain things to certain people. And so, you know, it becomes problematic and the communication gets convoluted. So Ted, I do see here that they're asking for a break. So I want to make sure I give you the moment.
That's my job, Dr. Moody, but I'll get us to a break and we'll come back on the other side and continue the conversation. I do want to remind our listeners that we have a hotline that you can call in and join the conversation. That number is 512-836-2887, 512-836-2887. You're listening to KAZI 88.7 FM. This is Central Health Talks.
Okay.
We're good. We're in a break now. Yeah, I saw the
This is Cheryl Cole, Texas State House of Representative for House District 46. I'm here to urge you to take the COVID-19 vaccine. This problem has plagued our community more than others. That is the communities of people of color. We know that we are impacted disproportionately compared to the rest of American citizens in our fight to maintain against this disease. I want to encourage you to get the vaccine to make yourself safe and your loved ones safe. Again, this is Cheryl Cole, House District 46. Thank you.
KAZI stands in solidarity with our community. For such a time as this, it is crucial that we all exercise the unity in community. Thank you for your continuous financial support and commitment to KAZI, especially during this challenging time for all of us. KAZI promises to keep providing relevant and reliable programming, timely updates, and useful information regarding valuable community resources. United, we stand. We are the pulse of the community. Remember, we're in this together. Because of you, our faithful listeners, volunteers, donors, and underwriters, Austin Community Radio, KAZI 88.7 FM, is still the voice and soul of Austin.
Tune into Jay Hunt every Wednesday until 5 p.m. for the Hump Day Show. Playing the best in classic old school jams, R&B, neo soul, and jazz.
Since 1982, we are the voice of Austin. Playing R&B, blues, southern soul, zydeco, jazz, gospel, rap, hip-hop, neo-soul, and much more.
There's a bright golden haze in the meadow.
You're listening to Central Health Talks on KAZI 88.7 FM here in Austin. Today we're talking about COVID-19, like the whole world is talking about COVID-19, but we're specifically talking about how this pandemic is disproportionately, unfairly affecting communities of color, but not just The inequity, I think we all know it's there, but what can be done about it and what is being done about it in our community? We do have a hotline, so you can join the conversation if you'd like to call 512-836-2887. We have two guests with us today, Dr. Charles Moody. He is a local pastor, author, and community organizer, and Dr. Yagoda with Community Care Health Centers, who's been literally on the front lines helping to fight this pandemic, specifically helping low-income communities, communities of color, making sure that they have access not just to health care, but information and personal protective equipment, ways to keep themselves and their families safe. I wanted to talk a little bit about why African Americans and Latinos, are at increased risk for COVID-19. I think we talk a lot about positivity numbers, and numbers are dramatically higher for Latinos and African Americans when it comes to just the positivity rates. But Dr. Yagoda, why does that matter? Why is that so important? And why are these populations at greater risk?
So from a fundamental equity standpoint, that one group is affected more than another presents some significant problems for a society that purports to treat all equally. There's so many deep roots to this inequity that have been storied for a long time. I think the COVID vaccine has really just shined a light on something that already existed for centuries. Frankly, the systematic racism, marginalized policy related to immigration, the structures that promote and maintain socioeconomic inequalities. It goes very, very deep. And I think to this question of why have particular populations been hurt more than others, we have to understand that COVID it's a respiratory infection, but it is dependent on community behavior, individual behavior, but also community behavior. And some within the community are privileged to be able to quarantine, isolate, follow recommended social restrictions more than others can. And so, again, as we talked about before, the ability to telecommute, the ability to have access to healthcare, all of these things have a direct impact on a community's individual risk.
Ted, can I jump in there?
Yeah, I was going to ask you, Dr. Moody, that's kind of back to the whole, we put out messages about, if you, stay home and work from home or isolate. Well, if you're a waiter or you're working construction, you can't telecommute. If you live in a family that's multi-generational in one household, you can't isolate. But please jump in, Dr. Moody.
Yeah, the current situation in terms of the economic situation of people of color is of course due to the history of institutionalized racism, which has really limited economic viability and mobility, intellectual mobility, healthcare mobility. And so, and we all know this statistic, but the greatest and the most relevant indicator of even your lifespan and livelihood is your zip code. And so if there are structures that have been put in historically, from laws about housing to laws about education, not just from the idea of Jim Crow, but even since Jim Crow, and especially in the South and the state of Texas. Texas is known historically to deal with voter suppression, to really increase the likelihood that people of color from immigration or what have you have a harder, more difficult life, which really increases what we call the allostatic load, that literal physical pressure and weight that it costs to be you. So if you can imagine systematically and through legal means, we can actually make it harder for you to live the allostatic load, then what it does in turn is it actually opens your body up or makes you vulnerable to the kind of diseases we're talking about. The stress level, because why? Because you live further away from a grocery store. So to go to a grocery store, it takes you, it's harder to get there. It's harder to go to work. It's harder to get there. To be employed, it's more difficult to stay employed. All of that convolutes into more diabetes, more high blood pressure, more heart issues, and that increased systematic allostatic load over generations then produces diabetes and things like that, which is exactly where COVID attacks. And so it's not just about where people live, but we have to also talk about why they live there and why they're in those particular situations. And that's historic, and that's what's really impacting them.
And that's what's really hard to change, right? It's not just about maybe opening a testing site or a vaccine site. Those things are important, but it's just part of this bigger challenge, right? This
Correct.
Bigger problem, centuries old problem. And we are going to get into vaccines. I want to invite our listeners to join the conversation if they have any questions or comments at 512-836-2887. I do want to get into vaccines because that is what everybody's talking about. Accessibility, and then just fear of the vaccine itself. There's a lot of misinformation out there about the vaccine, conspiracy theories, supposed dangers about the vaccine. But I also don't want to minimize the fear that some people have because frankly, in this country, with a history of medical experimentation, you can go back to the Tuskegee experiment, in the from 1932 to 1952. You had forced sterilization in Puerto Rico for decades. There is a real and legitimate fear of government programs, which some would say this vaccine is, and I don't want to minimize that. So let's address that. And I'll open it up to either one of you. How do we address that? How do we make people feel confident that the vaccine is safe and that they should take it and that they need it, their family needs it, their community needs it?
Well, I think, Ted, I'll jump in if that's okay. We have to acknowledge things on two levels. One of the things is we do have to acknowledge the history of abuse, that it goes beyond the Tuskegee instrument, to back in slavery, when, even when you look at many of our what we call our medical pioneers, the doctor of gynecology experimented on female slaves, the doctor of pneumatology experimented on slaves. So the idea that when you look at medicine and African Americans and medicine and people of color, you're going to have this history that goes up to the Tuskegee, but it goes far beyond that. So we have to acknowledge that. We also have to acknowledge that there are cultural issues of communication and even preconceived notions when the doctor sees that patient or the patient sees that doctor. What are the preconceptions that are sitting there?
Exactly.
Of mistrust.
So, and does the doctor look like you? Do they have the same life experience as you?
Right. And if you come in and do they expect you to be? They see you as a mother, and they see you bringing in your child, and they assume that you're a single mother. Right. They assume you have no insurance. Right. They assume that procedure you're not going to be able to afford that procedure. So we have to acknowledge that piece. But then, after we acknowledge that piece, we have to really work on it. And that means we have to now acknowledge that, okay, we do have that history, but now let's talk about how we can bridge that gap. And right. that means learning each other's language. That means sitting across the room, sitting across the table. That means opening your eyes culturally and recognizing your own bias and recognizing that you do have a bias and talking about it. And then after we acknowledge those two things, then we can start trying to really, really mend the fence. From an African-American standpoint, it's not just the history, but even if you look at religious biases, the question is, from some Protestant and even some Catholic, is this the mark of the beast? From our religious history, is this immoral? Is this, how do we reconcile this with our faith?
Right.
Is taking the vaccine the lack of faith? So these are the questions we have to really, really open up and answer and talk about from the faith standpoint, because people are complicated. So we have to look at faith, we have to look at history, we have to look at, and then culture, how you like to do what it is you do, what family means to you.
Right.
Because when we say, hey, stay away from each other, for some cultures, that's like, this is how we identify. So we have to really, really be inventive and really be creative about how we talk about it, who we talk about it to, and then do things like we're doing now, Ted, which is create community partnerships, because there are people who know the language of the streets.
Right.
There are people who understand the language of the people, and sometimes you need these translators that can translate the information from the people to the institutions, and from the institutions to the people. So these partnerships are the kind of things that work.
And people that are smart enough to know that they don't know, and they need partners to help them figure it out. So I may be talking about myself right there, but I want to take a quick break. We do have a caller on the line, if they're still there with us. Caller, are you there?
Yes, I am.
Welcome to the conversation. How are you?
I'm fine.
Do you have a question or a comment?
Yes. Oh, no, I have a question. Thank you, Dr. Moody, for an amazing talk show this morning. My question is, we in a community where white privilege is getting the vaccine before those of us, of color are getting it. Dr. Moody, can you shed some light on why is that, and how could something like that happen?
I can give you some. I can give you some. How should I put it? Some theories. I can't tell you all the, because if I knew all the secrets, I'd make sure it didn't happen. But the reality, but the reality is this: that it is true that people are trying to skip line, and people are skipping lines and trying to find networks. So one of the things, but that's because, once again, historically, when you see the issue of power and elitism, that's really what it boils down to. Power and elitism leads to this idea of where you really have this idea of you expect and you think that things should come to you, and so that idea of we have more power and we have more privilege. So this is not immoral. This is just a right. That's why it's happening. But what we have to do then is we're going to have to find those networks, eradicate those networks, and then make sure, once again, that we work collectively and collaboratively to ensure that the right people, the most vulnerable populations, are moved in front of the line, and making sure that they get access to every bit of healthcare, every bit of vaccine, and that's one of the things that C2H is doing. We are working behind the lines, under the lines, around the lines to make sure that we get people who need and who deserve the vaccine their proper.
Wow.
And that's what, thank you, caller, for joining us. And that's what Dr. Yagoda and Community Care are doing as well. Their focus.
KAZI, Austin Community Radio.
Their focus is exclusively on communities of color and people with low income when it comes to getting vaccines. So that group, you've heard the terms 1A, 1B. And Dr. Yagoda, can you talk about Community Care's efforts to get vaccines in arms of vulnerable populations?
Yeah, so I just want to second all the comments that have been made. Dr. Moody had hit it right on the head that these are long-standing disparities and ones that are just brought to light yet again. This is just another opportunity for us to make inroads again and trying to promote equity. From a community care standpoint, one of the most important elements is to build transparency on what is going on. And so, as we spoke about earlier, the first step in the pandemic was to make sure we understood who was getting tested. And so we can track who was coming up positive. And so we set up a public facing dashboard so just folks could have an understanding of what the demographic breakdown was in those who were being tested and those who were testing positive. Ultimately, this led to more regional advertisement of that breakdown as well. And we're trying to do the same thing around vaccines. The vaccine rollout has stumbled at first nationally, globally. And we see even on a global scale that it is the high income countries that are getting the vast proportion of vaccines. So the equity question is one that goes from the most local level to the most global level. What we're trying to do is just make sure that we have full transparency into who is getting vaccinated. From the early stages right now, it appears that we are tracking pretty well along what our general demographic is within our population. We are restricting vaccinations to just our established care patients, recognizing that they are among the most vulnerable in the community. And so we're just trying to do our best at the beginning to make sure everyone is aware of who's getting vaccinated and what that breakdown is along various demographic features.
That's a really important point, Dr. Yagoda, is if you are a community care patient, an established patient, and you are in group 1A, frontline healthcare workers, essentially, or 1B, 65 and older, or you have an underlying medical condition, community care is going to reach out to you to set up an appointment when it's your turn, in effect. And we'll talk later about how to sign up with the Austin Public Health portal for those who don't have a doctor or provider or don't have insurance. And we need to be transparent. That portal has had its challenges. It is not an easy system to use. And that's something that needs to be addressed, and we know is being addressed, but it is taking longer than some might have hoped for. But just there are people behind the scenes working around the clock to make that system work better. But I do want to ask you about vaccine safety, because if people don't believe in the vaccine and aren't prepared to get the vaccine, they're not going to get the vaccine. And so, Dr. Yagoda, could you talk about how these vaccines, multiple vaccines now, there's multiple manufacturers, but how they got to market so quickly, and how you're a doctor and you have family, how you can be confident that these vaccines are in fact safe?
Great question, and thanks for asking. I think, there are two, I see sort of two shining lights over the course of this pandemic. The first is really the grit and endurance and compassion of the communities who have responded to keep everyone safe, alive, and well. The other is vaccine development. I think this is really going to go down as one of the greatest scientific achievements in the last century. We now have 6 vaccines, only 2 of which at this point have emergency use approval. But we have 6 vaccines that are safe and effective. They've all gone through large clinical trials, and they've shown results that are frankly breathtaking. One of them had a 95% efficacy, which is almost unheard of amongst.
And that means what? 95%?
Sorry. Yeah. So 95% effective. When we talk about effectiveness, that measure is really looking at prevention of COVID-19, period. And for the most part, that includes not only very severe deaths or hospitalizations, but moderate and mild disease as well. So 95% effective is remarkable. It's also important for us to judge other vaccines which may have reported effectiveness that is slightly lower, to recognize that that's really trying to cover the full gamut of the disease from mild disease to very severe disease. It's really important to understand, when thinking about safety, it's really important to understand how these vaccines were developed, and that there are a lot of questions.
Even the word clinical trial, I can tell you for some might be that sounds scary, like clinical experimentations. Maybe you could explain what that means and why actually that should give us confidence that it's safe.
Yeah, so thanks for bringing that up. A clinical trial is made of volunteers, people who step forward and say, I want to participate in advancing science and health and well-being in general. And they volunteer to either receive the vaccine or receive a placebo. They do not know which they receive. The doctors who administer, the nurses who administer the medication don't know which one they've received. It's all blind. It's what we call blinded. And at the end, all the results are bring back, and the results have been coded in a specific way that it can be deciphered later on to understand, to break out the groups into a vaccinated group and those who just received essentially saline water, what we call a placebo. And from there, we can interpret the outcomes of the people who got the placebo and compare that to the outcomes of the people who actually got the vaccine. And the outcomes were truly remarkable in most of these cases, that those who got the vaccine were healthier, were not, and across the board, amongst all 6 of the vaccine trials, there were 100%, the vaccines were 100% protective against death from COVID-19. Not a single person who died.
Remarkable.
Right. And this is going to be a really important point. Not a single person who got the vaccine died from COVID-19. Not a single person who got the vaccine was hospitalized for COVID-19. And frankly, not a single person who got the vaccine died from the vaccine either. So the effectiveness and the safety are really important to understand. And when we think about a respiratory illness or an illness that is primarily respiratory like COVID-19, we have to think of the flu or the common cold. We as a society have accepted that the common cold is part of our life. A mild illness, a mild viral illness, in many cases that is seasonal, is something that we're willing to accept. What we're not willing to accept is the severe illness and death. If we have vaccines that can eliminate effectively death and vaccines, we're now talking about being left over with mild illness, which we already have set up as something that is not preferred, but acceptable. And so
is that where we're headed with, you think, with COVID or coronavirus? Do you think that's where we'll be in a year or 2 or 3, where it's just sort of like a seasonal illness like the flu?
I think that's the direction that we're headed. It depends in large part on how the vaccines end up. We have some single dose vaccines, which will be much easier to push out, don't require very cold storage, only require a single dose. But ultimately, once we get adequate coverage of the population locally and nationally and globally, we will probably looking at a circumstance a year or 2 down the road where it's just like many of the other coronaviruses which cause common colds,
right?
Not as much of a pressing issue.
I think we're all dreaming of that day. I do want to pause. We have a caller. This is KAZI 88.7. We've got a caller on the line. Caller, are you there? I think there we go. Hi, welcome to our show.
Hi, good morning. Thank you. And thank you for this conversation. I have a quick question. If the vaccine is given to the public, why do I have to be in the MAPS program to get the vaccine from community care?
Dr. Yagoda, do you want to take that? I think I have the answer, but I prefer to have a doctor answer it.
Yeah, right now, so great question. And again, this has to do with how do we manage a limited resource? We, in collaboration with different partners around the community, in particular Austin Public Health, have had to sort of divide up the labor involved of getting these vaccines out. What we've agreed is that community care will be allocated a certain amount of vaccines to vaccinate their population, given that we have such a close working relationship with those who are already established with us. Whereas Austin Public Health, which has access to additional resources to do mass vaccination, will be the focus point for those who are not yet established at community care. It is not certainly an attempt to exclude folks, but really to do targeted work with the resources that we have right now. As the vaccine flow becomes more abundant, our hope is that we'll be able to be more and more inclusive. But right now, even within the community care patient population, we are only able to target those vaccines to those who meet the 1B criteria. I hope that answers somewhat your question. I know it's not a perfect solution.
And if you're a medical access program or MAP member, you may be a community care patient, but you may be a Lone Star or People's Clinic. You may go to elsewhere for your medical home. Sorry. I want to also emphasize with MAP members, the reason we've been focusing on trying to reach our MAP members is when we do that, our MAP membership is essentially it's made up of 70% Latino and about 10% African American. So if we can reach our MAP population and make sure they get the right information and they can ultimately get vaccinated, we are reaching vulnerable populations that need this information and this vaccine as quickly as possible. We are going to take a break. This is KAZI 88.7. You're listening to Central Health Talks.
As a bright golden haze in the meadow.
Support provided by the State Fair Classic.
It's more than just a football game. It's a party. It's a homecoming. Saturday, February 27th at the Dallas Cotton Bowl. It's the State Fair Classic. It's Gremlin taking on Prairie View. The kickoff starts at 3, but the party goes all day long starting at 1. With DJ Twins on the Gremlin side and DJ 4.0 on the Prairie View side. Plus a live concert with Drew Hill.
Wow, this is about to be Super Bowl.
This is a social distancing event and face masks required. Here's where to get your tickets.
Tickets are also available at Willie's Barbecue, Marshall's Barbershop, and Jackson's Barbershop.
Support comes from Austin's Housing and Planning Department, helping to make homes accessible for Austin's seniors and persons with disabilities through home repair, programs, resources, and more. For more information, austintexas.gov/Austin is my home or call 311.
Tune in every other Sunday at 5 p.m. with Kurt Childers for Sunday Evening Jazz.
Thanks to all our listeners for supporting KAZI radio station throughout the years. You are very important to us. If you would like to be a sponsor or underwriter to promote your business or events, we offer affordable underwriting sponsorship packages. For more information, 512-836-9544. That's 512-836-9544.
Since 1982, we are the voice of Austin, playing R&B, blues, Southern soul, Zydeco, jazz, gospel, rap, hip-hop, neo-soul, and much more.
There's a bright golden haze.
Welcome back to Central Health Talks on KAZI 88.7 FM here in Austin. We do have a hotline if you want to join our conversation. We're talking about COVID-19, vaccines, and the safety and efficacy, meaning effectiveness of the vaccine, and why this pandemic continues to really hit hardest vulnerable populations that have historically been subject to health inequities. And so that's been the focus of our conversation today. We have two guests, Dr. Moody, a local author, pastor, and community organizer, and Dr. Yagoda, who is with our community care health centers here in Austin, Texas. Dr. Yagoda, I did want to ask you a quick question about vaccine side effects. So most of the vaccines, or I think all of the vaccines that are currently available, require 2 doses. Can you talk about, are there side effects with getting the vaccine, whether the first or second dose? I've heard the second dose may have more side effects, but that's actually a good thing because it shows you that the vaccine is working.
Yeah, it's exactly right. For those who get the vaccine, generally the first dose comes with fewer side effects. The second dose is stronger as the body builds more and more of an immune response. Some people have no side effects at all. Some have mild effects, pain or swelling at the injection site, some headache or chills. Some people even get fever. All of these, it's important to understand, these are normal reactions to vaccines and are not a sign of coronavirus infections. Rather, this is just evidence that your body's building up the strong defense against the virus. There are a very, very, very small number of people who have developed severe allergic reactions, as there are with any vaccine. We call this anaphylaxis. This occurs extremely rarely. It usually occurs within the first few minutes of getting the vaccine. And this is one of the reasons why we have everyone wait 15 to 30 minutes after getting their vaccine. It's easily treated. But it's also one of the reasons why, if you have previously had an anaphylactic attack, which is a severe allergic reaction to other vaccines, we don't recommend that you get this vaccine. But again, that is extremely rare. Most people have mild side effects. They tend to be a little bit worse after the second day, maybe lasting 1 to 2 days. I do give some what we call anticipatory guidance to my patients about this, to expect that they may be a bit sore or under the weather for a day or two, but this is just a sign that their body is building a critically important defense against this infection.
And the vaccine does not include coronavirus, so it does not include the live virus. So you're not being injected with COVID.
That's right. And this is really important. I think there are a lot of concerns that one could get COVID after getting this vaccination. We have similarly seen a number of people feel worried that they have gotten the flu after getting the flu infection, when in fact it's the body's building of an immune response to those infections. You can kind of think of it as providing a wanted poster for your body's immune system to recognize what that potential infection would look like. The infection itself, the wanted poster, doesn't cause the crime. It's the criminal on the poster who causes the crime. So while it's prepping your body for it, it doesn't involve any ability to replicate or even have larger components of the vaccine. The virus, it's only one small piece of virus that is quickly destroyed after your body learns to recognize it.
I've heard Dr. Moody Pac-Man analogy to describe it. I like both of these, the wanted poster and Pac-Man. We have a caller on the line, if they're still there. Let's pause and welcome the caller to the conversation. Are you still there?
Yes, good morning.
Good morning.
This is Alfie Miller calling. And my question is in regards to the second dose that we were just speaking of. With the limited count that you have and the attempt for the mass vaccination, have you accounted for the second dose in this limited quantity that you're getting? And if so, are there any tracing involved to make sure that the second dose is given? And are you holding those doses for those individuals for the second dose?
This is such a great question. Thank you for that. Dr. Yagoda?
Yeah, brilliant question. And one that has not, we've not settled in terms of the value of using all available doses for first doses versus completing second doses. Right now, we are following CDC recommendations, and we have allocated. The vaccines that we receive are either earmarked for first doses or second doses. So we ensure that those who have gotten a first dose will have access to a second doses, and we are tracking that internally. But you do bring up this really important question, and I think we still have a lot to learn from additional studies of, is there greater public health value to simply using all vaccines to administer as many first doses as possible? Or do we round out based on the vaccine trials that have already been completed with that second dose? Right now, we are following CDC recommendations and doing that second dose allocation. And yes, you will be assured your second dose, though, because the supply of vaccines is not regular at this point. There may be some delays by a day or two, but that has been understood to not be of concern in terms of developing an immune response.
And what I've read, Dr. Yagoda, if you could confirm, I think getting the first dose gives you 50% protection. I'm oversimplifying, I realize that, but it's that second dose that is really vital, that gives you that up to 95% protection. Is that right?
That's right for the initial vaccines that have been approved from Pfizer, BioNTech, and Moderna, more or less. that second dose is really what is believed to give you that longer term, more robust protection.
Thank you. Dr. Moody, I have a question for you. When you are on the pulpit and you're looking at your congregation and people are looking at you for guidance, some might have fear in their eyes, legitimate fear about this vaccine. What is the message that you use to convince them that the vaccine is important and critical, and when it's their turn, they should be prepared to get the vaccine?
Thanks, Ted. I use one is logic.
I know you use a Pac-Man reference because I've heard that one.
Okay, I'll share that one. I share that the idea is when you get the vaccine, what it does, if you remember the old Pac-Man game, the Pac-Man would eat up the pellets, and your job was to guide it through the little maze, eat up the pellets and eat up the ghosts. If you look at the vaccine, what it does is it strengthens and increases the Pac-Mans. And so whenever the ghost or any type of virus comes in, it strengthens or it aligns the Pac-Man so they're ready to chomp up any type of nasty ghost or pellets that are in your body.
As a Pac-Man player, I'm dating myself, but that one resonates.
Yes, but I tell people with logic, number one, why would we get the vaccine? Well, logic says this. Number one, they're giving the vaccine to the first responders, doctors, and health practitioners first, which means this: if they're going to try to kill you, why would they kill the health practitioners and doctors and everything else first? Those are the people who are needed to take care of us. So logic would say that argument doesn't make sense. And the second L is love. That because I love my parents, I love my grandmother, my grandfather, my people of faith, my community, myself, my spouse, then I get it because I want to put them first. When we look at our faith, our faith is about putting somebody first, and the love of God moving through us to minister to others. So this vaccine is a way to make sure that we help to minister to others. You might not get sick, but you might make somebody else sick. So I say love your mother, love your grandmother, your friends and family, and do it for them to make sure that they're safe, because at the end of the day, we want to make sure that people that we care about have a long and healthy life.
I like it. I like how you, Dr. Moody, can bring it back to a message of love, because there's so many other messages out there, fear, anxiety. So that's a nice way to bring it home. We do have a caller on the line. If they're still there, caller, are you still with us?
Yes, I am. Thank you.
Welcome to our show.
Thank you for this discussion. My question is, can you tell us what percentage of African Americans that have been vaccinated? And the reason I ask this is because I have a lot of people in my circle who are eligible to receive the vaccine, and they have even attempted to get it, but unfortunately, they have not received it.
It's a good question, and I don't have the exact number. And Dr. Yagoda, I don't know if you have that number for community care or not.
I can speak to very briefly that and this is data that's now almost a week old, the last time that we posted on our website, but of the first almost 1,500 patients that were vaccinated, 11% of those were Black. That is consistent with the distribution, the demographic distribution within community care. Again, I'm only talking about our ability to outreach within community care to our patient population in general. I don't have the broader numbers that APH may be preparing through their mass vaccination.
And Ted, I'll say this very simply, we might not be able to give a number, which I get. My short answer is not enough.
Yeah,
agreed.
And so that's why we're having these kind of discussions and these kind of partnerships.
Yep, I agree with that. We are coming to an end today. We want to thank everybody who listened. Want to thank our guests, Dr. Charles Moody and Dr. Nicholas Yagoda, for your wise words and insightful comments. We do encourage you, if you haven't yet, to go to the Austin Public Health website and sign up for a vaccine. If you are a community care patient or you're an established patient at People's Clinic or Lone Star, you're in their system and they will contact you when it's your turn for the vaccine. But if you can, go to the website, Austin Public Health, and fill out that form. It is a little bit of a challenge. They're working to make it easier, but if you can do that, we would encourage you to do so. We really appreciate you listening today, and just hope that you stay safe, stay protected, and be ready when it's your turn to get the vaccine to do it. It's important for you, your family, and the health of our community. You're listening to Central Health Talks on KAZI 88.7. Have a great day.
You guys ready? One, hide my view, and I'm take a photo. Okay, one.
And we are clear. All right. Thanks, everybody.
Thank you so much.
Thank you.
Wait, one more. 1, 2, 3. Thank you. Great job,
Thank you guys.
everyone.
Great.
Thank you guys.
Really good conversation.
Thanks, everyone.
Appreciate it.
Thank you so much.
Have a good day.
See y'all later.